All right, I think we can go ahead and start. Good afternoon, everyone. My name is Vishwanath. I am one of the 4 co-principal investigators of the UMass Boston Dana-Farber Harvard Cancer Center U54 partnership. We welcome you to our annual Workforce Development Symposium. Our partnership has been in existence for almost 16 years or more, depending on how you count it. We have been just renewed again for the 3rd round. We have a variety of activities that include training and research capacity building, outreach, and of course, funding research projects in the area of cancer science and cancer disparities. We are deeply committed to the issues of diversity and inclusiveness in all of our activities, and today's symposium is a part of that effort that we have been making for the last few years in a more explicit and explicit way. So I'm delighted that we are able to organize this symposium this year. Unfortunately, of course, we are on Zoom. And one of these days, I hope we can do this in person, resume our in-person activities. So today, the way the panel, the program is structured is that I will start off and introduce the keynote speaker, followed by a question and answer session. So if you have any questions to the keynote speaker, please use the Q&A box. Most of you by this time are familiar with how Zoom works. It will be followed by a panel of distinguished speakers who have been giving this issue a lot of thought, introduced by my colleagues and colleague, Dr. Adan Colon-Carmona, followed by moderation by Dr. Jill Makoska. The question and answer session will be of the keynote speakers. After the keynote speakers talk, will be moderated by my colleague, Dr. Goyo Ebdel. Now, I want to introduce our keynote speaker. I'm thrilled to welcome a colleague, a friend, and a well-known, one of the most prominent researchers of social determinants of health. Dr. Anna Diez Roux is the Dana and David Dornsife Dean and Distinguished University Professor of Epidemiology at the Dornsife School of Public Health and Director of the Drexel Urban Health Collaborative. Dr. Diez Roux is known for her research on social determinants of health, of population health, and the study of how neighborhoods affect health. Her work on neighborhood health effects has been highly influential in the policy debate on population health and its determinants. I think a lot of people are familiar with her seminal work in this area. More critical and more germane, in addition to her international prominence as a researcher, Dr. Diez Roux is also a very distinguished leader in promoting academic diversity and inclusiveness. She is one of the co-principal investigators of a NIH FIRST grant. In fact, she is one of the recipients of the NIH FIRST grant. This is a new initiative called Faculty Institutional Recruitment for Sustainable Transformation. It's an effort to promote recruitment and retention of diverse faculty, and it's just notable that Dr. Diez Roux led and co-led the program at Dornsife and Drexel, and they are one of the first award winners. A lot of people are looking at you with envy and seeking advice on how to do this. This is amazing, I think, and very impressive. It demonstrates your commitment to this issue. So today, Dr. Diez Roux will speak on why diverse and inclusive teams are critical to improving population health and eliminating health inequities. Again, she'll speak for about 20 minutes roughly, and then take questions moderated by Dr. Abel. So please put the questions in the question and answer session. But Anna, welcome. Thank you for joining us. I know how busy your schedule is. We are delighted to have you here.
Thank you. Thank you so much, Vish, for that very kind introduction. It's my pleasure to be here. Let me share my screen. So there we go. You can see the slides okay, right? Yeah, okay.
Yes.
So it's my pleasure to join this group and share some thoughts and reflections with you on why diverse and inclusive teams are critical to improving population health and eliminating health inequities. And as Vish said, of course, you know, having had the opportunity to receive this first grant has really forced us to really also, you know, think very carefully about this and the implications. So for everything that we do, for how we do research, for how we recruit faculty, for how we support faculty, for how we promote faculty, everything. So I'm going to do three things quickly in the 20 minutes that I have to start the conversation. First, I really just want to start grounded in the scientific questions, and the social problems that have to do with the persistence of enormous and often intractable health inequities in our society. So I'll talk about what some of the three challenges are, and I hope that by talking about those, it will become clearer what the research agenda is, and I'll talk a little bit about that from my perspective, some ideas for a research agenda. And all this, I think, I hope will support the final point, which is why diverse and inclusive teams are so critical. So I'm going to start out with the three big challenges. And to me, the first big challenge in health equity research, and I would say in population health research generally, is really expanding the conceptual frameworks for both understanding and for intervening on health. And I think we have, our field has been quite successful already in expanding models beyond the traditional biomedical paradigm. And I'll show you some examples. This is one example of a model which incorporates factors at different levels. I'm sure you're familiar with these kinds of things. A model that pays a lot of attention to multiple pathways linking more distal or upstream determinants to health and illness. Models that emphasize the life course and potentially even intergenerational impacts, and models that incorporate an understanding of fundamental causes like racism and the multiple ways in which they impact health. And these expansions of the conceptualization have been very important and very useful both in research and in action, I would say. And this has, you know, grown in some ways to be called the social determinants approach, factors at multiple levels, multiple disciplines, multiple sectors beyond healthcare, certainly incorporating healthcare, but not restricted to healthcare, a life course and intergenerational perspective, multiple causal pathways and mechanisms involved, this intersection of domains, and the population and macro level factors writ large. And all this has been very important, I think, has really fueled a lot of research and policy action, I would also argue to some extent, within the health equity and population health realm. But even beyond that, beyond this, I think we have, you know, heard a lot of discussion about this over the past couple of years. The causes of inequities, I think we have to recognize, are structural and systemic. And these words are used a lot now. And so I want to be precise in the way in which I am using. And structural really relates to the arrangement and relations between parts of a complex whole. And systemic relates to a system, not a particular part, but how parts interact with each other within a system, regularly interacting or interdependent groups of items forming a unified whole. So this means that if we really think about the systems that are driving health and health equity, we have to recognize that they are what's sometimes referred to as dynamic systems, factors at multiple levels of long causal change, heterogeneous and interdependent units. This means people interacting with each other, influencing each other, neighborhoods influencing each other, recursive relationships, that means feedbacks, reinforcing or buffering feedbacks, endogeneity, not as something that we need to analytically control, but as a fundamental way in which these systems function, fundamental characteristics of systems, nonlinear effects, multiple paths to the same outcome. People can get cardiovascular disease or cancer in very different ways, or similar distal causes can lead to multiple different kinds of outcomes. The role of history, history in the sense of across generations and over time in the big way. And all this means that we have emergent patterns that are not reducible to independent effects. And this is something that we have to grapple with because it leads to what's often referred to as policy resistance, the tendency of interventions to be defeated by the system's response to the intervention itself, or when obvious solutions fail or even worsen the situation. And so really, this means that we need to ground research in theoretically based and systemic conceptual model. And this is fundamental to deriving socially useful explanations and critical to identifying and framing the questions, deciding the study design, figuring out what data we have to collect, and even interpreting the results, because our questions should not be driven by the methods that we are most used to using, but they should be driven by the reality that we want to understand. So this is my first challenge, pushing the boundaries of the conceptualization to incorporate this dynamic systems approach to understanding the causes of health inequities. The second challenge, which in some ways flows from this first one, has to do with fully reaping the value of multiple kinds of methodologies. The causes of health inequities have all these characteristics, which I've already talked about. So for all these reasons, a single method is just not enough. We cannot understand this complexity with a single methodologic approach. And it's not about complicated systems modeling either. It's about different complementary approaches to understand the whole system. And so we are very used to observational studies in public health and epidemiology, but we know that observational studies often have challenges for causal inference. Sometimes we need to do experiments if we can. Sometimes even when we can do experiments, the experiments have unexpected results. We need to understand why they work or why they don't work or under what conditions they work. This often leads us back to observation, and both observation and experimentation can sometimes be integrated. The findings can be integrated, their implications understood together better through things like systems modeling. And systems modeling itself often raises questions about, identifies gaps, things that we actually thought we knew, but we don't know. And so that often motivates new observations or experiments. And of course, we have action, public health action, which often has to happen in the face of incomplete evidence. And by evaluating that action and learning from it, we can also learn about the system itself. So evaluation, and I put a quote from John Powell down there, which I like a lot. And he says that rather than thinking of evaluation of action simply as a means to understand whether or not an intervention worked, we need to think of evaluation as a way to better understand the system itself, and also qualitative approaches. So what I'm getting at here is that we really need an evidence generating system. We need folks in the health equity world who can work with different methodologies and can talk to each other. And this means extending the interdisciplinarity even further beyond medicine, epidemiology, sociology, and psychology to a whole range of other disciplines that are necessary to understand the very complex problems that we want to first understand and second act on. The third challenge is also related to methods to some extent, but it's about integrating across a range of things that we can do, which range from precise description to ideologic research to intervention research. And I think it's important to remember that there is really a continuum of policy relevant questions about distribution, COVID has been a perfect example. Simple data on the distribution, hard as it has been sometimes to get at, is enormously important for policy action. Also questions about etiology, and also questions about the impact of specific interventions. So there's really a continuum of things that we need to look at and approaches. And so if looking for, to give a more concrete example, if we're interested in how socioeconomic position affects health, we can think of socioeconomic position as sort of a very broad antecedent that leads to multiple causal pathways, or we can hone in on education as one dimension of socioeconomic position, or we can think of it as a hypothetical intervention, increase the years of education, or we can think of it as a, quote, practicable intervention. Well, what would we actually do to increase years of intervention? Perhaps provide an economic incentive, for example, to continue in education, or even a practicable intervention under a specific circumstance. And in some ways, as we move up in this list, the questions become broader, less specific, more general, and need to be looked at with a range of methodologies that are not necessarily the traditional experiment. And in contrast, as we move down, we're becoming much more specific in the process, and we're really getting to experimental and implementation science kinds of questions. But really, this is a continuum of questions, from description to ideologic, broadly defined, to implementation research, and all inform ideologic understanding and action. And sometimes I think in the health field, we tend to separate ourselves out. I'm an ideologic observational epidemiologist, so-and-so is an interventionist, so-and-so is just looking at descriptive data, but we don't realize that they all contribute to understanding and need to be thought about together. So these are my three challenges: expanding the conceptual models, fully reaping the values of causal methods, and integrating insights and conclusions all the way from precise description to ideologic and implementation research. Now I'd like to share with you just very briefly a few ideas for a research agenda on health inequities that connects a little bit to these three challenges. The first has to do with ideologic in the broad sense. I think there's still plenty of need for ideologic research to understand, in particular, how systems generate health inequities. How systems generate health inequities, and not shying away from the big causes like structural racism and inequality, demonstrating exactly how that works, how that operates in a way that is very specific. And this means developing perhaps new theories and constructs, developing dynamic and yet specific conceptual models. It can't just be a model with everything in it. It needs to be specific to the question, and that's where the challenge lies. A scientifically rigorous yet realistic and broad approach to drawing conclusions about social causes. This gets back to some of the things I was talking about: multi-methods, multidiscipline. It's not only about quantitative causal inference in the traditional and narrow sense, as important as that is. New data, big data, linked data, and improved synthesis and meta-analysis. So these are some of the things within etiology. There are lots of challenges in drawing conclusions, often from etiologic studies in the social determinants of health, because we don't do a good job of synthesizing and meta-analyzing the results for a number of reasons that make this complicated that we could perhaps talk about, but nevertheless, it's an important need. A second area, a research area, has to do with mechanistic understanding. So really understanding how it works. And this is important because it can confirm and legitimize distal causes by studying proximal mechanisms. And it creates more of a compelling narrative of why these phenomena that we see are causal and therefore justify an intervention on the social causes, right? So really thinking about mediation in a more sophisticated way, recognizing the complexity of mediation. We often tend to think about it in a very, very traditional, simplistic way, like adjust for one and see what happens, et cetera. And we know that that doesn't really do justice to the way mediation really occurs. The interface between social world and biology, many examples of work looking, say, at epigenetics, gene bioenvironment interactions incorporating social factors, the effects of social determinants on the process and outcomes of healthcare. For a number of reasons, the world of social determinants has de-emphasized healthcare often, mostly to make the point that there are all these other things outside of healthcare that are important. But at the same time, we need to incorporate healthcare because it can be very important in some situations, and we really need to understand how social determinants affects the outcomes of healthcare. And many people, I'm sure many of this audience are working on this. The third area is policy evaluation. A big need, I think, in this field, evaluating the health impact and the health equity impact of policies within and outside healthcare. And this is very challenging, but we need to broaden the range of the policies that we look at. We need to broaden the tools that we use, because that's the only way we can study the impacts of these policies. We will not be able to understand their impact through randomized trials exclusively, although there may be some situations where randomized trials are feasible. Look at the interactions between different types of policies. I think we don't do this enough, like interactions between certain healthcare policies and social policy. How do they work together, potentially, synergisms? And specifically, the impacts of policies on the size of inequities. And there's this figure shows the range of policies and interventions that we can be looking at. And this is a little bit of a typology that classifies policies that act on the social determinants of health based on the stage of the social causation process at which the intervention operates at the top, from most proximal, i.e. policies targeted at individuals, to policies targeted at the level of society, and also the level at which the intervention is implemented. And so you can see it's an enormous range and an enormous heterogeneity. And this is what makes this area so challenging, because each kind of policy requires, in order to study its impact, we require a different kind of design, a different kind of data, et cetera. And last but not least, implementation research. This also has been an area with which the field of social determinants has only more recently begun to engage, I think. So equity-focused implementation research, including the traditional things that implementation science looks at, like factors influencing the adoption of a proven intervention in certain groups, or why it works differently in different groups, or but also implementation science beyond the clinic. And by this, I mean things like when, why, and how is research on health inequities translated into policies, perceptions about causes among the public and policymakers. This is so important because ultimately, I believe that changes in public perceptions, in the stories and the narratives around the causes of ill health are what is really needed to shift the actions towards addressing fundamentally the social determinants. And also the process of communicating and understanding evidence about health disparities. We did with a colleague here, Jonathan Pirtle at Drexel, we did a survey a few years ago on city health commissioners, asking them about this. And it was quite interesting to see where people got information from, what they interpreted, what they thought were the gaps, et cetera, et cetera. So there's a whole area of research in this that we don't pay enough attention to, I think. So these are my 4 ideas for areas for a research agenda in terms of ideologic, mechanistic, policy evaluation, and implementation science. And all this building up to the title of my talk, which has to do with why diverse and inclusive teams are so important to address these challenges and to advance this research agenda. And I think it's obvious that they are critical. And I've summarized some of my thoughts on this in just 3 or 4 slides. I think this idea of expanding our conceptual models and formulating what I call realistic conceptual models, i.e. that capture reality. For this, we need diverse perspectives and we need people with different lived experiences. Because this is fundamental to the questions we ask, to the hypotheses we posit, to our ability to challenge the, quote, dominant paradigm, which is so important because I think in science, we often get into this repetitive, replicating within the same paradigm, the same kinds of studies, the same kinds of, to some extent, predictable answers. And sometimes that needs to be shaken up. We need to question that paradigm. And for this, diverse teams, people with different perspectives, different experiences are fundamental and can really lead to breakthroughs in understanding. And I think for health inequities, this is fundamental. I also think as I've highlighted earlier, there's a really important role of interdisciplinarity and diverse methodologies. Because otherwise, we each have our disciplinary bias. We were taught in certain ways. We tend to see problems in certain ways. We tend to formulate research questions in certain ways. We tend to collect and interpret and analyze data in certain ways. And that hampers our ability to increase our understanding. Quantitative and qualitative approaches, the collection and interpretation of data, the inferences that we draw, to improve all of this, we need teams that are also diverse in interdisciplinarity and methodological approaches. Also, we need to think outside the box instead in terms of identifying interventions and policies. Because if we are constrained by thinking always about what we have been able to do before, we will never be able to think about what we really need to do to get things to change. And for this, I think diversity is critical because it opens up our minds and it opens up the conversation to things like, what is desirable? What is possible? Or if it's not possible, what should be possible? And how can we make that be possible? And identify policies or interventions that are outside the traditional toolkit. And for this, diversity, different lived experiences, different histories is also fundamental. There is actually scientific evidence that shows that diverse teams are better at solving problems. These are just a few examples, work done by Scott Page and others. Very interesting if you're interested in this kind of work around complexity and how diverse teams lead to better outcomes actually when they're trying to solve a problem. So there is actually a scientific basis for the role of diversity in addressing complex problems like the ones that we face in population health and health equity research. Also, aside from understanding the scientific problem and identifying new solutions, diverse and inclusive teams are critical for communication and dissemination. Some of the things I was talking about, implementation science beyond the clinic, changing public perceptions, the enlightenment role of evidence. So evidence is not just about providing evidence that this works and this doesn't, but it's about changing the mindset, changing people's ideas about what the real causes are. And also empowering those that are traditionally marginalized with information that they can use to advocate for themselves in different ways. And for this, of course, diverse and inclusive teams are critical. And last but not least, they are also critical because even if all the other stuff was not true, we would have a moral obligation to redress unfairness and past injustices that have limited people's abilities to fulfill their lives. And this has to do with access to opportunities and resources, replacing exclusion with inclusion, and has multiple synergistics and multiplying effects. So underlying all this, there is also, at least in my mind, a very strong moral and social justice motivation for diverse and inclusive teams. So really, this is having diverse and inclusive teams allows us to change the perspectives, allows us to see things in a way, see the same thing in a way that we were not seeing it before. And I will just finish up with a couple of quotes that I like. I really like quotes, so I can't resist putting them in talks. This is a quote from Noam Chomsky. Science is a bit like the joke about the drunk who's looking under the lamppost for a key that he's lost on the other side of the street because that's where the light is. It has no other choice. In order to look in other places, we need diverse teams. Otherwise, we will keep looking under the lamppost. And this is a quote from Forrester, sort of one of the founders of systems thinking. And he says, in the complex system, causes are usually found not in prior events, but in the structure and policies of the system. And that is what it's really about, understanding those systems so that we can nudge them in the right direction, or shake them up so that they move in the right direction. And for this, these diversity of approaches and perspectives and communications is really key. And I can't resist putting in a plug for our program, which Vish kindly referred to. This is the Drexel FIRST faculty corps. We are finishing up our search this year, but we will be launching a new search next fall as well. And so if anyone is interested, I encourage you to contact me. And thank you so much for your attention. And I look forward to your comments or reactions or questions. Thank you.
Thank you so much, Dr. Diez Roux. That's really a very, very interesting background and certainly makes the argument for diverse and inclusive teams in very specific terms. We don't have any questions just yet, so I'm monitoring the
Okay.
question box, but I have one of my own, which is really about the FIRST program. And when you put the application together for that, did you make an argument to NIH sort of like the one you made to us based on some of these conceptual models, or what do you think made it so successful as a first run?
Yeah, I don't know. We got people ask us that a lot. Our application was centered around the health inequity, health disparities theme.
Yes.
So even though we have areas, we focus in particular on 3 domains within that: age and chronic disease and environmental determinants, but we did frame it in some ways in this way. And we talked about the conceptualization of health disparities or health inequities, and talked a little bit about why the inclusive excellence, which is what NIH is seeking to achieve with these programs at these institutions, is so important to be able to address this scientific problem, right? And as you probably know, there is in addition to in supporting the success of these FIRST investigators, there is also a broader agenda of transforming the institution and many of the practices within the institution, so that this can be a sustainable change. And that, of course, is more complicated because we all work at institutions, so we all know what it's like. So that's another big piece of this, and we talked a lot about that in our proposal as well. Yeah,
it definitely there's always the research component of it, but wanting to have a lasting impact on the culture of the institution, and getting a big grant definitely gets the attention of the institution as well. So that's I think it's sort of a symbiotic thing, but you're absolutely right that the goal is not to have short-term change, but a longer-term change.
Yeah.
So, well, we
have hands up.
Okay. Oh, Dr. Viswanath. Yes. Sorry, I was looking too much in the question box here.
No, thank you. Anna, that was great. Thank you so much. We needed the theoretical framework. So, coming to, today's issue of creating, say, diverse teams. So within faculty or within STEM areas, whether it's in faculty, academic institutions, or in other institutions which depend on research, So what is wrong with our theoretical model? I mean, why is it that we have not been so, I mean, you laid it out so interestingly, right? Policy, systems, culture, and we have been, I cannot, every other week there is a new report from National Academy of Sciences on lack of diversity in STEM, etc. Is there something fundamentally wrong in the way we are conceptualizing it, in the way we are failing to recruit, or even if we recruit sometimes, we're failing to retain people, retention is an issue?
Yeah.
Maybe I'm being very pessimistic, but I have seen so
No.
many of these reports and efforts.
Yeah.
So.
Yeah, no, I think you're right. I think you're right. I think this in some ways, this is an example of this policy resistance problem, we try things, but nothing works, interventions fail or they're defeated by the intervention itself. And to be honest with you, I think this FIRST program is also a little bit, is an experiment. And, there are sometimes, sometimes I feel that there may be, the ambition to transform the institution is great, but higher, this may not be enough to transform the institution, even though it is a big grant and we're going to hire, 12 people, but is that really going to be enough? I think the problem is that we have to address it at multiple levels, and it's not only at the level of the university. It begins before, right? It begins with opportunities that people have early on, and then it just kind of becomes augmented over time. And I think certainly, I'm sure there are things that we do in universities that perpetuate and reinforce this. And I think that's the kinds of things that we need to try to understand better and then act on. And honestly, I don't know that we really know that much about what we're really doing, and sometimes completely unintended ways, to disadvantage some folks over others. The funding system itself, we all know that, all the issues with it, right? And how, and also what institution you're at and what context you have, and all these things then reinforce each other. So it's a really tough problem, because it's also so rooted in our society that, we can't expect a university or a set of universities or an NIH program, ambitious as it is, and I commend NIH for doing this, to be able to change all of that, so it's hard, but it's great that NIH I really commend NIH for really paying attention to this, for trying something different. One of the things, for example, is that, as one of the, I think, really positive things about the FIRST in terms of the faculty is that they come in with protected research time, and really the focus is on getting them to write R01s. And I have seen many junior faculty, particularly from underrepresented groups, who get trapped in the K. So they write the K, and then they have the K for 5 years, and then they can never move on to the R01, whereas they have to be ambitious and just go for the R01, right? I mean, certainly build up to it, do what they need to do, but I have seen people be very intimidated by an R01, or maybe getting advice not to submit an R01, right? And so I think that is, that's good. We're kind of changing the way we think about that. And so, but it's complicated.
Dr. Colon-Carmona.
Thank you, Goyo. On a great talk, really stimulating. You bring up a lot of great issues. And the issue that or my question is related to your team's section. And you highlight interventions and policies as one of the challenges, potential challenges at the institutional level. And certainly, there's different policies at different institutions, but I agree with you on that policy issue. Some of these policies, exist for years and years and years, and they perpetuate sort of bad habits of institutions. And those are really difficult to change. So how are you going to create these new policies that are a counter to what has been done for years? And so I'm wondering whether you had any thoughts about potential policies that are outside the box, that institutions could really take on So some general thoughts on what some of these outside the box policies might be to really tackle that.
Yeah, that's a great question. I don't, certainly there are modifications. There are things that may appear small, but can be impactful, that can be made to existing policies and practices, even start before getting to the other kinds of bigger things, which I think is what you're asking about. But in terms of, for example, in the process that we've done for the search, for the first search, our search has been across two academic units, across public health and the College of Nursing and Health Professions, which has been a completely different experience because we're doing a search across two academic units together, faculty from different units together, focused with certain criteria, but from things like, what data do we have on applicants? What data does our HR office collect on applicants? Reviewing together, and I know search committees are supposed to do this, but to be truthful, often they do not do this, right? To sort of track through the process as you do screening and selection, what is happening to the characteristics of the, to the summary characteristics of the applicant pool. How is that? And so we have realized that we are not collecting the information that we need to collect, and that we need to think about ways to look at it differently, as to provide feedback to search committees on how their actions are having consequences on the pool of applicants that we have, for example. Also, very important conversations about how we evaluate applicants. How we evaluate applicants who come from very different institutions, who have had different opportunities. If we stick to the usual, how many papers, that kind of thing, then of course, we continue the same system. I think one of the things that the FIRST requires is this, a diversity and inclusion statement as part of the application. And I think this, I know there has been a lot of debate about whether these things are useful or not. But I think what it has done is really elevate the role of contributing to a culture of inclusive excellence as one of the criteria that we use to evaluate applicants. So it's not, and they can contribute in many different ways, right? So it's not only about their CV and their potential, scientific potential, but it's also about how they can contribute to this culture. So that's already, a bit of a shakeup. So there are a few things like that seem small, but then I think can have big impacts. In terms of broader policies, I don't know, I'd really have to think about that. But of course, there's always the tenure and promotion process. That's always something, to be looking at. And I think we will be looking at it again in the context of this. We did an update to ours not too long ago with attention to these things, but I'm sure there are further improvements that can be made. Yeah, I think those are some ideas, but I know I can't totally answer your question, but.
Thank you. Dr. McCosker?
I will keep this brief because I don't want us to get off track here. But I'm very, very much thank you for your talk. And I'm glad we're recording this because I think I'm going to watch it a few more times. There was a lot in there. But I have a question, in terms of getting institutional buy-in, whether it's an academic institution or industry or whatever, Ford Motor Company, whatever it is, how do you get beyond just the kind of moral recognition that this is something we should do? We should have diverse teams, we should have equity and inclusion within our company or whatever. How do you get past just kind of the low level rationale for doing that and get people to really buy into the real value of having diverse teams?
Yeah, that's a great question. I mean, I think we tried to make the case, and I think we did make the case with our institution, because the institution is providing significant cost sharing for this effort. That we need this to do good science. It's about doing good science, and it's about addressing problems differently and solving them, problems that we have not solved. And so if the university really wants to have impact, in terms of generating knowledge, in terms of generating action, our university is very committed to civic engagement. Well, this is what we have to do. So it's not only about, making our numbers look good, in terms of percents or whatever. It's really about improving the quality of the product of the university. And for this is fundamental. And I think that, I think that is an argument that I use a lot. It can be enough or maybe not, but I think that is a crucial argument, that it is really will make the university better. Help it attract more students, help it bring in more money also, all those things are all interrelated.
Thank you. We have one question in the chat, or whatever the question answer thing is, that I'll summarize. This is from an anonymous attendee who thanks for the presentation and wants to know if the grant is able to take in non-citizens or non-nationals. And then in your proposal, was that something that you thought about or brought up? And what are your thoughts about this issue?
We have had a very open approach. We have not excluded anyone. So citizenship is not an exclusion criteria. So we have been very open about that.
Okay. And then one final one that just came in was talking about thanking you again for a wonderful presentation. And are there some strategies that have been successful to address these issues earlier in the pipeline, such as high school and undergrad? Also, how can we change NIH requirements for trainees? There are limitations in the salary level for trainees that discriminates against those who are primary breadwinners and leave academia.
Yeah. I'm not sure I'm the best person to talk about how to address this earlier in the pipeline, because I don't have experience in that, but I think it has to be addressed also earlier in the pipeline. So I'm sorry, I can't provide a very satisfying answer to that. In terms of the second part of the question about NIH requirements for trainees, yeah, this is a big issue. We recently, we used to have our trainee stipends at the school in general pegged to the NIH level, and we just decided to end that because it was just too low. And so we recently went through that process. That is a big issue that NIH, I hope, will look at soon, because you're absolutely right. They are too low, and they certainly affect who can be a trainee. Right,
Yes.
who take these positions. So
especially if you have a family and you're, you kind of make choices between what you're going to do. And with a lot of our training, people get to the stage of actually being young faculty way later than they would otherwise. So, well, this has been a terrific discussion, and I'm sure we could go on for a long time, but we're going to move to the panel introductions now with Dr. Colon-Carmona. Thank you so much, Dr. Diez Roux. That's awesome. And again, I'm with Dr. McCosker that will be reviewing. I feel like when we have a lecture, like, oh, can I get a copy of those slides? So I may ask you for those.
Thank you.
It was really terrific. Thank you.
Thank you for the opportunity. Thank you so much.
Great, thank you very much. Again, my name is Adán Colon-Carmona. I'm at UMass Boston, and it's really a great pleasure to introduce our distinguished panelists. Our first speaker is going to be Dr. Debra Franko. She is a Senior Vice Provost for Academic Affairs at Northeastern University. Prior to her arrival at Northeastern, Dr. Franko held academic positions at Wesleyan, UMass Dartmouth, Harvard Medical School, and Mass General Hospital. Dr. Franko's scholarly and teaching interests includes the general areas of women's health, specifically in eating disorders. She has been principal investigator and co-investigator of numerous NIH grants, examining questions related to adolescent depression, body image in girls, and risk factors in childhood throughout adolescence. She has published extensively, including hundreds of journals and book chapter of the board of directors of the Academy of Eating Disorders in 2011, and was this recipient of the 2015 National Eating Disorders Association Award for Excellence in Prevention and Advocacy. Our second speaker is Dr. Marcus Lambert. He is Associate Vice President for Research Strategy and Operations and is an assistant professor in the Department of Epidemiology and Biostatistics at the State University of New York, Downstate Health Sciences University campus. Dr. Lambert focuses on initiatives to expand downtown's extramural funding research portfolio, particularly focusing on health disparities and public health research and training. Dr. Lambert is also one of the PIs of the Translational Program of Health Disparities Research Training, or Transport. It's a $10 million grant from NIH to form Translational Health Disparities Research Program, with a focus on recruiting and training underrepresented minority scientists. Prior to joining SUNY Downstate, Dr. Lambert was an assistant dean of diversity and student life and assistant professor of education research in medicine at Weill Cornell Medical School, where he led NIH-funded initiative to maximize student development program to increase the number of and enhance the success of PhD students from underrepresented backgrounds. And then finally, we'll have Dr. Villa-Komaroff. She is founder and principal of Intersex SDB, Science, Business, and Diversity Consulting. She is the chair of the KGI School of Medicine Board of Governors. Previously, Dr. Villa-Komaroff was CEO and CSO of Cytome, a company developing and manufacturing purpose-built cell sorters, and still serves on the board of directors there. She has held academic positions at the University of Massachusetts Medical Center, Children's Hospital in Boston, Harvard Medical School, and as an administrator, she served as vice president for research at Northwestern University, vice president for research and chief operating officer at the Whitehead Institute. She continues to serve on councils for NSF, NIH, and national academies. She has participated in a number of boards and committees for several organizations and is committed to advance equity in science. She has received numerous of distinguished awards. And one of my favorites, of course, is that she is one of the founders of the Society for the Advancement of Chicanos, Hispanics, and Native Americans in Science, or SACNAS. As a reminder to the participants in the audience, please use the Q&A button to answer any questions and or comments. And with that, Dr. Franko.
Thank you. I am really happy to be here today, and I want to say thank you for inviting me. It was a wonderful first talk, and I hope that mine will launch from there, as I'm going to focus on leadership and really thinking about how our diverse and inclusive teams are led, whether that's at in a research setting, in a university setting, or industry setting. And so I will start with the question, why now? And if you were all in front of me instead of out there in Zoom land, I would ask you, what do you think this picture is? So I can't hear your answers, but I will just let you know that this picture came from the Chronicle of Higher Education just a few weeks ago as I was thinking about this talk. And these are actually the highest paid college presidents in America. And so I think a fairly quick scan of these pictures tells you something. There are a lot of white people on this screen, more men than women, and certainly very few men or women of color leading our institutions of higher education around the country. So the why now, I think, continues to be an important question. And I think one that this quote is now 20 years old, but I think continues very much today. Diversity promotes opportunity for equity as an emergent change agent in the structuring of higher education, while leadership promotes practices that identify diversity as a nested context for achieving an equitable balance in the social relationship between higher education and society. So I want to talk today about a program that we started a couple of years ago called the Northeast Faculty Leadership Program, Success Through Diversity, that was funded by the Alfred P. Sloan Foundation, and share with you a little bit about the program elements, about what we've done so far, and our thoughts about going forward. We developed a consortium model, that is 7 institutions, to put together this grant. The Sloan Foundation asked that we focus on STEM fields as we thought about our leadership program. And the consortium of the 7 institutions, which I'll show you in a minute, builds upon strengths and numbers at the Boston area institutions who form the consortium. And we have a steering committee, and they include both STEM faculty and STEM administrators at those institutions. And we were very lucky, as I said, we're here at Northeastern leading, to have a number of institutions in the Boston area join us in this endeavor. And certainly UMass Boston is high on that list, and we have a number of people here who participated in that program as well, the first round. One of the reasons we did the consortium really had to do with numbers. That is, we think about leadership for underrepresented minority faculty and teaching and developing skills so that they might move into leadership positions. We looked at the numbers of particularly underrepresented minorities in STEM fields. And even in the Boston area, which is probably the most saturated place for universities, the numbers are very small. And so we use the consortium model to spread the net widely and to get our participants. So in terms of conceptualizing the leadership program, really we had one purpose: to address the dearth of academic leaders of color. And just a few statistics: when we look at university presidents, the number is small. When we look at full professors, 2%, 1%. We look at assistant professors, really not much better. And these are data from a few years back. And the hope would be that when we get ACAE data again, that these numbers look better, but it happens slowly and I think needs to happen with great intention. And leadership is one way to move toward that. There are lots of barriers to address. Black, African American, Latinx, Native American, Alaskan Native faculty face a number of barriers to leadership that we know from research and certainly know from talking with our faculty. Certain structures in the workplace, the kinds of practices that occur, systemic racism, feedback networks that may not be there, professional development opportunities that may be lacking, invisible cultural beliefs, an increased service burden, lack of exposure to political strategies, and hypervisibility, or in some cases, invisibility. There could probably be a longer list, but there are a number of barriers toward leadership. So the structure for our program was really modeled after a program we had here at Northeastern, but really took into account developing leadership skills that increase the likelihood of faculty moving into academic leadership positions, to increase networks, building interdisciplinary connections within institutions and across institutions, enhancing one's self-perception of being a leader, and addressing a number of those barriers that affect faculty of color. Our curriculum had a number of components: a 4-day intensive skill building workshop, then 4 2-hour sessions called How the University Works, and a team project where the group of participants were divided into smaller groups to work on a particular project and present to university leaders. We also infused the curriculum looking at issues related to barriers. We had a first cohort who we ran in January 2020. Our plan was to do that for about 8 months. We had to take a hiatus, as you could imagine, and so we picked it up again in an online way so that we went a bit longer. From 8 schools, we added 1 to our consortium. We had 14 participants, so the numbers were very, very tiny despite efforts to cast the net widely. 8 associate professors and 6 professors, 4 women and 10 men, 8 faculty who are Black or African American, and 6 who identify as Hispanic, Latino. And we looked at a number of topics in that workshop: leadership, creating a vision, thinking about visibility, what barriers people face, giving, receiving feedback, assessing landscapes, managing conflict. And across that 4 days, we brought in guest speakers who represented diversity to discuss their leadership journey. The second part, in terms of how the university works, we covered a number of topics, again, with leaders who represented diversity, whether that was talking about university culture, communications, general counsel, budgets and development, government, community relations, all various things that were outside what a faculty member might do in their own department or their own college or school. We got some good feedback from our initial cohorts. I won't read those out loud, but generally people felt as though the program was quite positive for them and that we addressed elements that mattered and helped them to be moving on their journey toward being a leader. We looked at outcomes in terms of a number of measures, and both quantitative and qualitative. Won't have time to present that today, but I have a paper in press that talks about that. To date, 4 of those 14 participants have moved into positions of leadership, including 1 associate dean here at UMass and other universities. And we'll do a 1-year follow-up with interviews with that first cohort. We're very excited to start cohort 2 in June of this year, where we have now 21 faculty from 10 institutions. So we've cast the net more widely across the Northeast and expanded that recruitment so that we could get more participation. Our future plans would be to do our data analysis, continue that to our follow-up interviews, and continue to build networks between participants, faculty members, their mentors, obviously to apply for future funding and to share our findings and to gather ideas from audiences like you. So some references, if you'd like them, I'm happy to send, and I want to say thank you very much.
Great, thank you, Dr. Franko. Dr. Lambert?
Thanks so much, Adon. Are we ready to begin my portion of the presentation? Okay, so I'll share my screen. I have a few slides.
Debra, you want to stop sharing?
Oh, I'm so sorry. I thought I had. Sorry.
I didn't want to cut you off, Dr. Franko. It's a great presentation. I didn't know if we were going to do questions.
Sorry.
But we'll save them to the end.
Okay, we good?
Yep, thank you.
Apologies. I hit an X that I thought did it and it did not.
Okay, and can you all see my screen okay?
Yeah.
So my name is Marcus Lambert. I serve as the Associate VP for Research and Associate Professor in the School of Public Health and Department of Epi and Biostats at SUNY Downstate. We're in Brooklyn, New York. Actually the only full-fledged academic medical center serving all of our 2.6 million plus Brooklynites, and predominantly in an area that is largely Caribbean American, African American, within central Brooklyn. So you can imagine some of the health inequities that come along with that, but it presents a really great opportunity for us. I wanted to highlight a paper that just recently came out from a colleague and myself. We were invited to do a commentary, and we sort of joke around that it's an opinion piece on diversity, equity, and inclusion opinion pieces. Essentially, we are really encouraging the field and commentaries to move towards scientifically evidence-based practices around investigating issues of diversity, equity, and inclusion, which I'll refer to largely as DEI. I think we, especially at the onset of the events of 2020, there were a lot of commentaries and talks and opinions about what our approach should be. But I really love, it was just such a brilliant talk by Anna earlier, just about how we think about, our theoretical models and approaches to certain things like health inequities. But I think it's the same thing when approaching DEI. We have to approach it with theoretical approaches grounded in the literature. There's a lot of evidence to point towards the types of decisions that we should be making in the space. And I really appreciate her emphasis on structural and systemic approaches to things. And I just actually, borrow a lot of this from, a social ecological framework of looking at, behavior change. But thinking about the barriers that come along with DEI and opportunities in the context of, this sort of systems level approach. And that is basically not just looking at things from the trainee perspective or this sort of deficit model of, well, underrepresented groups have to, there needs to be more of them, or there has to be this sort of level of training or enhancement for them to reach this sort of standard of excellence that we require at our institutions. Whereas actually looking at our institutions, looking at our policies, looking nationally to see what sort of environment, what sort of structural frameworks exist that really perpetuate and create these barriers. And so, you look at from the national perspective, we hold a lot of responsibility in our funding agencies, in our scientific societies, and our national conferences. These are really fantastic opportunities to think about policies that can sort of, not perpetuate some of the access issues, the inequities that ultimately, affect our trainees, our clinicians, and people, who are part of our spaces. And then, certainly at the institutional level, there are obviously, schools and colleges and companies and so forth. Departmental level, there's the interpersonal level, which you can think of sometimes as your offices or labs or clinics, and then the individual space. And at each one of these levels, if you take, for example, the national level, you look at barriers, for example, like funding gaps for underrepresented groups. What can we be doing to address barriers at that sort of national level that have this sort of policy or this sort of systemic effect across everyone, no matter if you're at this institution or this part of the country or that part of the world? What are these sort of larger systemic level changes that can be made? And funding gaps is one of them, but have we thought about these sort of opportunities that can affect it? And you look at examples of like the ESI status or early investigator status. This is something that the NIH, for example, not to just pick on that funding agency, instilled a number of years ago that ultimately, I think as they look at the data, starting to have an effect on the type of applications that are received in the interdisciplinary science that's done. Why can't we have a sort of similar status for that looks at diversity? Because it already exists for F31s and sort of these training fellowships, but what about at the R01 level? What about the research project grants? So just thinking in that sort of framework that have these sort of larger national or international effects. You look, for example, at the institutional level. At the institution, what power do these institutions hold in terms of affecting DEI? Faculty diversity is an often clear example, but how often are we looking at our policies around hiring, our policies around recruitment, and not just the policies? Because I was at an institution where we looked at those policies, we made changes, but actually putting those policies into practice and ensuring the checks and balances that they actually happen was another step. So really looking at that holistically. You look at, for example, at the level of departments, which each department can have its own microculture or its own micro environment, own policies that are specific to the department. You take promotion, for example. How often are we looking at promotion practices, tenure clock? And I even highlight leadership here because one sort of mini study that we did at a previous institution, we looked at who was not getting promoted, right? And why they were not getting promoted. And it wasn't because they weren't reaching this sort of promotion evaluation committee. Once they reached that committee, they received promotion. It's that they weren't being put up for promotion. So oftentimes the division chiefs and the leadership and the chairs who held that sort of power over who gets sort of nominated or promoted or encouraged to apply for promotion was a real sort of limiting factor for us. And then you look at, of course, at the interpersonal level, there's often a lack of mentorship for diverse groups, access to certain types of mentors, and even, we're doing studies now to look at the types of mentorship that underrepresented groups gravitate towards. But then, I think Dr. Franko presented an amazing cohort sort of model. There are a number of these sort of cohort models that are really great when it comes to leadership development and mentorship, but also thinking about incentivizing the mentors, finding those people who are really great mentoring champions and helping them to perpetuate and increase more of what they do good. And then finally, at the individual level, thinking about our trainees and how we prepare them for these transition stages, and not just leaving that on the trainee themselves, but the institution. Are we going to really take responsibility for them? So I won't go into too much detail on these other slides. I know this is quite busy. I just want to direct your attention to a couple things. If we look at faculty positions, so in this sort of first circle here, we just took a look at NSF data recently from 2015 to 2019, just to see what is this snapshot, what is the picture for faculty diversity? I mean, has it really changed much? And the answer is no. And the green bars here represent white male and white females, Asian males, Asian females, Hispanic males and Hispanic females, and Black males and Black females in blue. And some groups that are not listed here, the data was actually not available from NSF at this granular sort of level. And the numbers, as you can imagine, would be less than 1%, very, very tiny, but not to exclude those groups. But it just highlights that, with the single digits here, we have a long way to go. And it's even, as one might imagine, not much greater at the full professor level. So, and that, it's not so equitable across groups, particularly Hispanic women, Black males and Black women at the full professor level are just still at 1%. And this is within the STEM fields. And this is just sort of another way of looking at the data. You see, for example, in the green represents full professorships, affecting some groups a little bit more than others. But this also we see affects or has some effect ultimately on funding status and funding gaps. For example, at we all think many of us are familiar with the Ginther study in 2011 that highlighted disparities within R01 awards based on racial ethnic identity. And those funding gaps are still sort of existing, although we're closing them in some respects. We still have a long way to go. Quite a complicated slide, but I'll just point out a couple things that, for example, Black R01 grants from 2013 to 2020 has increased. There's been a 219% increase, but the actual funding gap and the proportion of those grants still remain very tiny. And then for Hispanic and Latinx groups, there's also been an increase with the number of R1s that are attributed to those individuals who identify as Hispanic, but only represent 5% of those successfully awarded grants. So I think this is, to me, a compelling reason for the why we need to pay attention to these things. It's just the inequities are still there, even after all of the work that we're doing to try to move the needle in terms of diversity. And then I'll finally just point out, which again was the purpose of that recent commentary, is that we can't just look at difference. We can't just look at diversity, because, and I think this was really highlighted in 2020, there are a lot of issues that affect inclusion and retention and ultimately inclusive excellence. And in our spaces, how are we treating other people? Are we being inclusive? Are we, really making sure that there's just a comfortable space where people feel valued? And we did a study in 2020 that looked at postdoctoral fellows, which is this often the step before faculty. And one of the biggest differences and one of the biggest predictors for whether postdocs will choose to go off into these faculty research intensive positions was around career mentorship and a supportive community. So it just sort of validated what we often would see within these spaces, that our trainees, they want to feel valued, they want to be respected, they want to feel like they belong in these environments. And we have to really actually begin to look at the data that's going to help support those notions as well. So that's it for me.
Great, thank you very much, Dr. Lambert. Dr. Villa-Komaroff.
Let me unmute first and share my screen. I'm going to go very rapidly because I'm going to build upon the question which really permeates this entire discussion. And that is, why have we made so little progress over so much time when so many of us are convinced, and our colleagues, that this is a good thing to do? that we need diversity, that diversity is a value that has been increasing over time. And yet, as you've heard, the numbers do not change. Now, I'm a molecular biologist by training. And so when I left my last full-time day job, which was some time ago now, I decided it was really time for me to try to focus on this issue. And so I began to educate myself in fields which most of the people you've heard today are really expert at and have been studying for a very long time. I'm a newbie. But what it seemed to me was going on here was, in a sense, something which folks who study psychology and sociology and some aspects of neuroscience have taken for granted for a long time. And that's really that the way the human brain deals with information is something that we have to take into account when we try to figure out what we do about this very fundamental problem in our society. The human brain is a very remarkable structure, of course, but nevertheless, as complex as it is, it cannot deal with all of the data that it receives on a continuous basis from all of our senses. So all nervous systems have found ways to ignore much of that input. And in our case, we take information from a number of sources, and we tend to make shortcuts so that we don't have to think about some of the decisions that we make. And that is results in something which all of you will be familiar with, which is implicit bias. And it's my feeling that the fact that most natural scientists, that is chemists, biologists, neuroscientists, all of us, because we don't know much of the literature that's available in psychology and sociology, ignore this as we try to reinvent the wheel about what we should do about the lack of diversity. So I'm going to just go very quickly through for those of you who are like me and are not part of the field. So we've known for a very long time that humans make systematic errors in judgment. This has been studied extensively, for example, in decision-making about money. We make bad decisions about money on a routine basis and regularly, even when we know that we're doing that. And we've developed mechanisms to make these decisions because of the massive data that the senses provide every second. It's a big data problem, basically. And our brain development primarily occurs after birth. That's when we are laying down the way in which we will think about our society and about our life. And so the environment, that is the social environment into which we are born, the beliefs that are held by that society, are going to greatly influence the way we think about things and what things we're going to take for granted. Now, these mechanisms are indeed the result of evolution, but that doesn't mean that we can't change them. We are the best species in the world at dealing with our evolutionary deficiencies. We don't have fur. We invent clothes, learn how to use fire, learn how to build houses. And I regret to say that scientists in the natural sciences have been particularly resistant to the notion that mental processes affect their decisions. So the way that I try to explain this to my colleagues, because I think until we convince people who are running the institutions that we're all dealing with, who are running the agencies, that they are making mistakes in their thinking, which are leading to a perpetuation of this thing that we have lack of diversity in our institutions, is because we don't take this into account and try to deal with it. And all of you know about optical illusions. You look at these tables, you're going to see them as a different size. I do, and they're not. You can take the PowerPoint and trace the table, first table, rotate it, slide it over the next table, and it will fit. You can do this yourself by finding this on the web. Now, implicit bias stems from associative errors. We make associations as we grow up, and many of those associations come through our daily life as we're growing up. We just imbibe them unconsciously. And those beliefs and reactions that we have may be counter to what we think we believe and how we think we want to act. We're not aware of this. There's a part of our brain which makes decisions without our conscious awareness, and it can affect who we choose as our colleagues, how we relate to people who look different from us. It's a human thing. This lack of diversity is not a problem of white people doing explicit bias, although clearly in our country we still have a great deal of that, but rather people not being aware of the cultural basis of our implicit biases. And therefore, we just don't recognize them. We don't build them into the processes that we have for when we are hiring colleagues to try to mitigate those implicit biases. And so, despite our good intentions, we continue to make inadequate progress. And it was quite a revelation for me to go to this site of implicit bias, which has been set up, and you can test your associations in a number of areas. And I suspect that you, like I, will be surprised at what you find. And I want to reinforce that this is something which all human beings share. So that here's an example from an autobiography, and I'll read it to you. We put down briefly in Khartoum, where we changed to an Ethiopian Airways flight to Addis. Here I experienced a rather strange sensation. As I was boarding the plane, I saw that the pilot was black. I had never seen a black pilot before, and the instant I did, I had to quell my panic. How could a black man fly an airplane? This was part of Nelson Mandela's story as he was relating his life story. And so it just illustrates the fact that all of us have these implicit biases, and we behave based on them unless we take measures to mitigate these biases, which are called in by our society, by our history, which if we don't acknowledge it, we don't talk about it, we don't deal with it, it's embedded in what we think about people who we perceive as different from ourselves. And it drives our choices, and we continue in the same situation where we have very few people of color advancing to the highest levels and to using the full talents to move our society ahead. And there is no magic bullet, of course, for any of this. You've heard in the previous discussions some of the wonderful programs which can be put into place. But for institutional transformation, there has to be recognition at the top and throughout the institution that these decisions are being made, have been made in the past, in part due to our unacknowledged implicit biases and what we think the culture should look like. And right now, I think that the fate of our country is a kind of a balance. We are now seeing a discussion, a very passionate and troubling one, where there's a segment of our population who explicitly do not want to discuss that history and that reality that we have. They call it protecting our children or protecting our culture. But if we do that, then we won't ever get out of this situation where we start new programs, we hire people, they are not retained. We do not bring in students of color. We do not train them. We do not recognize the leadership qualities that are there in so many of them, and the country will suffer for it. And so my work now is to really talk not to the folks who know this, but to the folks who are making the decisions who don't, to try to spread the word that that we do have this, that it's nothing that they are at fault for. It's simply a result of the enormous amount of information we have. And when people truly want to make changes in how we do things in an institution and recognize this, then we will see progress. And we are seeing that. We're certainly seeing that among the younger folks, and we're seeing that in some institutions. You've heard some examples here, but it needs to be more widely spread before I think we will finally see the arc of justice bend to where we would like it to be. So I'm going to stop with that so that we don't get too far behind, and we can go into the question and answer period.
Fantastic, thank you. As we wait for the Q&A to fill up a bit, I don't mind starting with a question, and then if panelists have questions, just raise your hand. In terms of, and all three of these talks were just excellent and touched on different aspects of a problem I have a question about, which is in terms of recruitment, retention, career success in terms of promotion and leadership positions for people of color in academia. Do you see a difference in those metrics between public and private academic institutions? And if so, why do you think that is?
I think it depends on which public and private institutions you refer to. I can think of examples where some public institutions have made more rapid progress because they are in an environment where they are free to do that. And there are clearly other cases where there's been regression in the progress that institutions have made because leadership at even outside the university is imposing things upon them. Private institutions have the advantage that they are not subject to state laws or state rule. And so that can allow them to be more creative and nimble. Old institutions have a trouble with that because they build bureaucracy, as institutions tend to do over time.
Any other panelists? Go ahead.
I would just add briefly to Dr. Lambert's point that the data are really important here. And I don't know that we have great data on this, particularly perhaps from the private institutions who don't really are not under obligation to share those data in a way that the public institutions might be. So it's a really good question. It's a little hard to know how to get to the answer. Sorry, Dr. Lambert, you were going to say.
No, that's a very similar point that I was going to make. And just to add to that, Deb, I've been interested actually in if a lot of minority serving institutions and HBCUs and tribal colleges face a lot of the same issues as other predominantly white institutions face for underrepresented groups, particularly, for example, underrepresented faculty. I'm not sure of the answer, but I will say that, I think part of it has to do with challenges. You take promotion, for example, a lot of those issues are things that are outside of the institution in terms of, grants and publications and so forth. So it's just going back to that sort of systemic level of the challenges being at the institution. There is another level of challenges that ultimately affect that institutional level.
Okay, thank you. Dr. Carmona has his hand up.
Yeah, thank you very much to all the presenters. This is a question to everyone, but it was something that Dr. Franko brought up. What's the power of leadership within those institutions, or developing these skills of leadership to transform the institution? Not simply just the administrators, but whole systems. What's that aspect of leadership in that? Anybody is welcome to comment.
I think that one of the things I would say is that it's critical that that happen. And one of the ways it can happen at the top levels, if metrics are being set, because as Dr. Lambert pointed out, departments and schools have enormous power. That's really where the decisions are made about who is hired and who is promoted. That a president of a university does not have that power. But what the president's power is to set metrics so that institutional resources can flow to departments which meet metrics about this issue. That's why I think we can be encouraged by the establishment of all these DEI offices. Although, there's some pretty interesting stories about how those offices have been eviscerated, even if they exist. But when they do, and when the intent is positive, then metrics, holding departments accountable, is a good way to make change.
I'd absolutely agree with that. And I think if you don't have it at those higher levels, it's very hard to do at other levels. I mean, it really has to be an institution-wide commitment that is not words said once a year during an address or a commencement or whatever it might be. But it really has to be an ongoing focused effort, as you point out, with metrics. How are we doing? If we're not doing well, why are we not? If we are doing well, how can we do more? So I think that kind of ongoing conversation is absolutely key, really at all levels from my perspective.
Okay. All right, we have a question from the Q&A from Anonymous. It's asking, is there any correlation between student acceptance rates for minority students and faculty diversity?
Good one.
I've seen this, yes. The AAMC has a pretty nice figure that basically shows a trend line as faculty diversity increases, medical student diversity increases. It sort of levels off at a certain point, but there is a significant relationship there, at least that's been shown for medical institutions.
Okay, I'm not seeing any other Q&As here. Any of the other panelists have a question or point for discussion?
Yeah, I have my hand up, Jill. I'll
You
ask
do,
the
sorry.
question. Right, that's okay. So one, I like the, some of us use the social ecological model quite a bit, so I like the different levels of influence. And I want to build on a Dan's question on leadership. One of the things I often notice is I want to raise the issue of network effect, on this issue. So, for example, every 4, 5, 6 months or so, or I get a call from somebody, some search firm saying, "Oh, you have been nominated for this dean's position we have, a chair's position, and we would like you to apply, etc." And I mean, if you are my friend, don't nominate me in the first place. But and somebody, then I run into someone in a meeting and they say something like, "Oh, did they call you? I suggested your name." And this is a purely network effect, right? I mean, I saw that story in the Chronicle that Dr. Franko put up. It's very clearly a network effect, right? Who gets nominated for these leadership positions? That's because who is in that club and who get. And you see this not just with the positions in leadership positions. You see that with who is selected for keynote speeches, for example, which are prestigious, which lead to more prestigious positions, who is invited for talks. And you can imagine all these usual criteria we use. I'm just thinking, what do you think of this network effect? How do you break into that network if you are not a part of the club?
I don't know whether Adan wants to speak to that at all, but we spent a fair bit of time about that, about underlining the importance of that, recognizing how difficult that can be to do, to learn how to do, to feel comfortable with doing, and then practicing how you make yourself visible, again, in a way that has to feel authentic and comfortable, but at the same time, reminds the people around you that you are there and you bring tremendous value and skills to the table. And people have, I think, varying levels of comfort with doing that and helping them, if they're interested in positions of leadership or places where networking really does help you, to get more comfortable with that, to practice it, and to try it out in safe spaces, probably at the beginning, and then broaden that reach.
But are we putting the responsibility on individuals and minority scholars? Is there something wrong with the institutions and the culture of,
Yeah, so I'm speaking to it from the faculty leadership point of view. I think you're absolutely right. The provosts and the deans who nominate the participants to be in our program also have to play their part and look very widely as they think about who's the next associate dean or chair or keynote speaker at a conference. And we have to help those people already in leadership positions to really look at the entire group, look at all people, and not miss people who could really provide great value. So I agree, both sides. My focus has been more on the leadership development side.
Yeah, I think that one of the things that it's a tough question, I don't really know the answer to it, is that early mentors are very important, because you want not just mentors, but sponsors, people who will do just that, who will tell you about positions, put your name forward for positions. And some of us luck into it. I did. All of my mentors were white men. All of them, however, had the thing which I couldn't verbalize at the time, but have recognized subsequently, that they really didn't care about they did not make prejudgments based on what a person looked like. You had to prove yourself, but there was no prejudgment. And there were, on the other hand, a lot of people who looked at me and immediately made a conclusion about what I was or was not capable of. And helping our students to understand and recognize that, and I'm not sure I know how to do that, because I don't know how I did it. To me, it feels like luck retrospectively, but there was some radar going on there that if we could teach would be very helpful, because it would keep our students away from toxic individuals and put them in the care of individuals who can really go from mentorship to sponsorship. I think the formal programs that are now being introduced for mentorship are a first step in that process.
It's such a really important question. And I'm reminded of a study that Joan Reed, who's at Harvard, did many years ago, where she looked at the publication network of junior faculty, I think presumably at her institution, and how that network and who they published with contributed to their promotion. And as you might expect, women and underrepresented racial ethnic minorities did not have as diverse of a publication network. They weren't publishing often with these sort of key nodes or these key individuals who exposed you to a more diverse publication network. And that ultimately had an effect on, or a statistical relationship to, their promotion. And, if you take that example, it sort of puts a lot of onus on those in leadership, those in power, those who have the diverse publication network to be more inclusive. Almost kind of going back to Adon's point about the impact or the responsibility of those with power and leadership to, have an effect on others who may not necessarily have access to certain networks. But I think there are great sort of interventions. I'm reminded of, Sakness Leadership Institute, these cohorts and models that almost kind of create their own networks. And as people grow in those networks, they're able to sponsor each other and be a part, intertwine networks and so forth. So I think we're testing out, ways to combat that, but it's certainly an issue.
Yeah, one of the things that mentors can do at a very early level, because there are cultural things at work here as well. There are certain cultures, Native Americans, Mexican American women, who tend not to be comfortable advocating for themselves. Advocating for others is easy. Advocating for oneself is very difficult. And in some cultures, simply not done, as a Native American friend of mine once told me. And so in order to try to deal with that, I think one of the most valuable things that happened to me as a graduate student was the graduate advisor required that all of the graduate students had to sit in the first 3 rows of the seminars, the departmental seminars, and we had to have a question. Now, I'm a back rower, or was at the time, and that was enormously valuable training. and helping to get over the discomfort of putting oneself out there.
Actually, when I was at Michigan, I was in a surgical department and they made all the residents do exactly that. Sit in the front rows and have a question, because it builds confidence. It's like soft skills, you know, and those are hard to teach, especially among people who might be a little reticent to kind of putting themselves out there. Any other comments or questions? Our Q&A is not filling up.
I have one.
Okay.
I'd like the panelists here to speak about the importance of these transition zones or these transition periods of someone who's going through these academic tracks in their sort of professional development, as these transition zones sometimes being barriers that someone has to overcome. And I'm wondering how these barriers in some ways really contribute to the some of the systemic problems that institutions have, where if some of these barriers that an individual has to jump, whether it's through, you know, because they're being promoted within the sort of the faculty or within even administration, you know, how do we deal with these barriers in a systematic way?
I think that Dr. Franko's program, and as well as Dr. Lambert's, are both efforts that are trying to do that, because very frequently, you know, back when I was on those tracks early on, there were no mechanisms for a faculty member to find out how the institution worked, or to find out what were the rules of the game. What did I have to do? What was important? You know, you were assumed to either have osmosed it, or you got lost or got behind. And so I think that those kinds of programs that you now see in effect are critical for those transitions, because knowledge becomes power. If you know how the institution works, then you know where you have to go, or to at least ask the question, in this institution, what do I have to do to make the next step? What are the benchmarks that I have to meet? And it seems to me that many more institutions are making that explicit. There are institutions still where none of that stuff is written down. It becomes then very idiosyncratic within departments or schools as to how that process occurs. And that's very bad for increasing diversity in any institution.
I think one of the other pieces of that is also to be really intentional about naming it when you see it, when you think about it, when you study it, but really to say that this is a barrier, that this isn't working, this keeps people back, what can we do about it? And to try to have those sort of sometimes quite difficult conversations, but to encourage units, whether that's departments or schools or broader institutions, to really think about what do we do in order to break down some of those barriers. And as we said before, to get specific, to use data, to think about metrics, to follow up. And that's one thought I have about that. It's a really good question. Thank you.
Okay, we have a question from the Q&A from Jennifer Ivers, who asks, I've noticed the higher many leaders, administrators climb in the hierarchy, the more conservative they may become as agitators or advocates. It's hard to build momentum with risk-averse leaders. Thoughts on that?
Good one. It's true, and that's because the higher administration served the interests of the institution, and the institution and interests of the institution and interests of the individual are sometimes in conflict. This is inevitable. And so really what you need is an institution which recognizes that and has positions which are meant to be bridges between the faculty and the agitators and the higher admin. That can be a vice president for research. It can be the DEI officer. Sometimes it happens without the institution being aware of it because of the individuals who get into those positions. But it is a real issue. And that's why I think it's important that for real change, you need top down and bottom up. It is because of the agitation that has occurred within this country and within institutions that some of the progress has been made. But it is adoption of those values that mean that they become entrenched in institutions over time. We're still very early. We've been at it for a very long time now, but we're still pretty early in the process, I'd say. And there was a question in the chat as well.
I think, Jill, you're muted.
You know, 2 years is Zoom and I still do that. I'll go to the next one in the Q&A, and then if the person who had the thing in the chat puts it in here, we'll get to that too. So this is from Julie Wright. She's in the School of Nursing. Wonderful and helpful information and conversation. It is very difficult to recruit, hire a diverse faculty, especially when there are limited funds to compete against private institutions. It seems we need to focus more on building pipelines and being mentors of undergraduates. What activities or strategies can we use to mentor diverse students to take the leap towards research in academia?
You have to make it look good. You have to figure out the things that you love about it. And I think, try to share that. There are wonderful things about research being in academia, obviously different worlds from lots of other places, but to try to send that out to your students. It's a tough one. It's a really tough one.
It is, and it needs to be modeled. I think that there was a period, and maybe it's still happening, where faculty would come in, and it's a hard life, of course. And faculty members very often focus on the hardness of it rather than the joy of it. And that is a very strong message to students. And then there's the reality that there aren't enough positions in academia for all of the people we're training. And so at the same time, we have to be allowing students to recognize all of the paths that there are. And they'll pick it up. And the younger they start, the better. It's really interesting. It used to be that you could not bring high school students into the lab because there were fears of liabilities at institutions. That's changed over time. And now freshmen, very often freshmen come in and they're ready to be in a lab and want to be. Those are the ones to keep an eye on because that's where the promise is. Those kids are already there. And we have to model it within the society. One of my favorite stories is my nephew, when he was 3 or 4, I think he was 4, met his 2 aunts for the first time. His mother is a lawyer, now a judge. And he met the other 2 of us. And he went home that night and he goes, "Oh, Mom, I can't be a lawyer, and I can't be a banker, and I can't be a scientist, because those are girls' jobs." What children see opens or closes doors that they do not even realize are there.
Yeah, I think also, it's funny to be on a panel where I'm the only physician. So I'm looking around, but my reference is always looking at residency when people choose what they want to do for their careers, and even from med school to residency. And it's always a connection you make with a person. I mean, had I connected with a surgeon, I might have, and I did. I had like a 2-week phase where I wanted to be a surgeon, but it wasn't a long-term connection. And it's all about the people. There's so many ways to find joy in life, either doing research or not doing research. You have to have somebody who has a life that you want and seems happy and fulfilled, and also makes it seem fun. And so that's where the connections are important. And in this case, part of the connection is also having access to people that look like you and have family structures and other things that you can see that are similar to you in some ways. So I think it's about making those connections. We do a lot in our partnership to try and make those connections with our programs for people in high school and in college, because I don't think it has to be that, oh, I got excited about this research when I was ready to do the research. It's about the idea of doing research. And then I think it's very similar to how we make choices as physicians too. So early and often seems, but maybe early and that special connection with someone who will take an interest. I also just was interested in what Lydia was saying in terms of how people didn't, in your career didn't gave you an equal chance. And I think that is very good. But I also think there's a responsibility for going beyond that and trying to understand what some students and trainees, other issues they've had in terms of getting where they are, so that equal is sort of not enough in some ways. But I think it's a place to start, certainly.
Okay, we have one. Oh, go ahead, please.
I was going to say there's one of the things that KGI, the Keck Graduate Institute, is doing in the new program is a Master's of Community Medicine, in which we are taking students who don't necessarily, the primary feeders is the University of California State, Cal State institutions, where the students, the requirement for entry is not high. There's no test scores required, and the minimum grade is 2.7, which certainly would not get anybody into medical school. And some of these students have already been working, and the curriculum is all built to bring them up to snuff so that they would be ready to be eligible for entry into medical school should they desire that, or they could go back to the job at a higher level than they were. This is a very early experiment. We still can't say it works. The first cohort has just completed their first year, but 17 out of 19 of them made the dean's list, which means a 3.9 GPA for the terms. So we're cautiously optimistic. Boston University, for example, is interested in following these students to see if they would be admissible to their medical program. And we've got 23 other medical schools who are doing the same thing. So experiments like that are audacious on the part of the institution, and also could change the way in which these kinds of things are done.
Great. Okay, we have one more question, and this individual, Sarah Minsky, typed it in twice, so I think it's important. If the protocols, norms, in academic institutions /STEM are framed by those who are in power, how can the shift happen without turning the power upside down?
Well, that's exactly what needs to happen. It travels both ways. And the tension in any society is the turning power upside down without destroying the institution, and the institution responding to those desires and advocacy that's going on in a productive way. And that's hard. I don't know that there's any one question to that. That's a really important, very difficult question. And you pick your thing depending on your inclinations. Some of us are built to be agitators, and others of us are built not to be. And so we do a dance.
Any other comments? Otherwise, I will turn it over to Vish for some final thoughts.
No, thank you, Jill. I just want to express my gratitude to the three panelists and the keynote speaker. This is a topic of critical importance to us. We are intellectually struggling with this issue. We will continue to struggle in a way that we want to advance this cause. And I think your comments today and your insights are extremely helpful in moving this conversation forward. Hopefully, we will look to you in the future, to continue this conversation, and we all will be a part of this movement, to push this and advance this in nationally and regionally. So thank you, each and every one of you, for taking the time to talk to us. I also want to thank the audience who signed up for it on a Friday afternoon. The very fact that there are more than 36 people shows the commitment to this topic. Thank you for joining us. I also want to thank our team, our staff who worked behind the scenes to put this together. I think it's good for us and easy for us to show up on the screen here and talk about these things, but the staff worked really hard behind the scenes, Abby Shine and Lexi Salters. So thank you both for your work behind this. and of course to my fellow co-principal investigators. Dan, do you want to say anything else?
Just want to echo Vish's gratitude here to our guests. It's been a really stimulating conversation. And Lydia, I think I'm an agitator. I think that some institutions need a little bit of that to really create some change. So thank you very much, everyone, both on the Zoom world and here in this room.
Thank you. It was great.
Take care, everyone.
Bye-bye.
Till next time.